So, what is the open enrollment period for health insurance and when is it? My name is Andrew Lee, and I'm the CEO of Health Mutual Network. We've helped thousands and thousands of people enroll into health insurance plans and saved a lot of people a lot of money. So, we know a thing about a thing or two, and we're an award winning agency. So, when is open enrollment and what is it for? So, open enrollment is the period when you can enroll into a policy if let's say you're on a policy that you did not like or did not work out for you, or something shifted with your policy, whether your doctor dropped out of network or you're in a different medical group, whatever the case is. This is your time to now change your policy. So during this open enrollment period, it's going to go from November 1st to January 15th for marketplace or FFM states. And in certain state-based exchanges, it'll go towards January 31st. So for example, California is a January 31st end date for open enrollment. So it's a 3-month period where you can make changes or you can enroll for the first time. So most of these plans are going to be subsidized, by the way. So there's going to be subsidized applied to your plan based off of income, household size, taxable household size, age, zip code / location. And again, your income from January to December. So the full calendar year. It doesn't hurt to check for subsidies during this time because from what we've seen in our agency, about 90% of people qualify for some subsidies at the very least. So if your income is shifted or, everybody's situation can change annually, you never know, right? So might as well just double check to see if you are eligible for subsidies. And if you're paying out of pocket for everything, this might help. All right, my second tip is for all the first timers applying. So if you're applying for the first time, again, this is all going to be based off of your taxable income for the whole calendar year. So let's say if you're unemployed right now and you're not working, your income is zero, right? And a lot of people will say, hey, Andrew, I'm making zero. Well, that's not the case, right? This is going to be the full projected, the expected annual income as it says on the application itself. So a lot of people get caught up on the income situation. So if you're saying that you make zero right now, it's actually not the case. It's year to date as to what's left to the end of the year. So the way that they characterize income is going to be, of course, W-2, or if you're 1099. If you're W-2, then it's going to be actually your gross income that you're going to project on your application. If you're a 1099 sole prop, independent contractor, then it's going to be your net amount. So it's going to be your deductions and your expenses out the way, and then your net amount thereafter. If you own an LLC and you are an employee to your own LLC, it's what you pay yourself as an employee that you'll put as your W-2 at that point. What I would highly recommend is get some assistance if it's your first time applying. I understand that. I know a lot of people are autonomous and, they could do the application online or just call in, but there's not that human touch. There's not that personalization because every time you call in, you're going to get a different agent, and then you're just going to have to give them a reference number and they have to go back and check on, what that reference number was, and it's just not the same person. Whereas if you go with an agent, there's no skin off your back in terms of price because you don't pay us to do your application for you. No skin off your back, free of charge for you. The way that we get credit is, of course, we're just going to customize your plan based off of what you're actually going to need it for, whether or not, if it's medication, if it's going to be doctor visits, if it's going to be whatever the case, specialist visits, x-rays, MRIs, everything in between. Whatever the case is, we're not really biased because whatever company that you go with would give us credit because we're going to be now doing the customer service on their behalf personally for you. So you don't have to call in to the company every time you're calling us for support. So we're also going to remind you of any documents you have to upload because in certain situations, you might have to upload your income, your proof of residence, maybe even your ID if it's your first time applying. So if you get caught up in anything like that, of course, that's where our expertise comes in. And also, we're going to check how much of a subsidy you're going to be eligible for. So we're going to go into a needs analysis and really go deep into how much of a subsidy we can come up with. That is, of course, going to be to the best of your knowledge, but of course, based off of what kind of employment you have and how you file your taxes. How do I qualify for subsidies and what kind of plan should I go with? So again, I mentioned subsidies are based off of your projected income for the full calendar year, your everybody in the household, your taxable household, your age, and also location. That's also going to play a factor into how much of a subsidy you're going to receive. And I'm sure you've probably heard your neighbor, a family member, yourself maybe. I got penalized this year. I got penalized on my taxes this year. So that could mean two different things. You either did not have coverage for 4 consecutive months in certain states where the tax penalty still is in effect, which is California, Washington, D.C., Massachusetts, and New Jersey. So those are the 4 states that still have a tax penalty. It's repealed federally, but it's still here on a state basis for those respective states. So let's say you made $50,000 and you put $30,000 on your application. Of course, you're going to have to owe back the advanced premium tax credit because they advanced it to you, right? So this is money that they give you for free. But if you made more money and you did not change your income either on your application or with us, then of course you're going to have to owe back the difference in subsidies. Now, vice versa, if you made $25,000 and you put $30,000 on your income, guess what? You get more of a tax credit on your health insurance moving forward. So it goes either way, right? So you're not necessarily penalized, you're given back what is owed. You're getting penalized if you don't have 4 consecutive months of MEC coverage, which is minimum essential coverage. At that point, then you're not going to get a tax penalty. Also, starting in November 1st, 2024, if you have not filed taxes in the last 2 years, you will not be eligible for marketplace subsidies. So please be aware of that. Tip number 4, make sure you know where you qualify in the federal poverty level chart. So if you are, let's say, right at the cusp of Medicaid, and every year sometimes Medicaid would go up in their qualifications. If that's the case and you're eligible for Medicaid and you're on auto pay with your current policy that's subsidized at $30 for you, and that gross amount was actually supposed to be $1,000 without subsidies, then guess what? If you're on auto pay and you lose your subsidized plan and you didn't cancel your policy, then if you're on auto pay, then they're just going to draft out the full amount. So be aware of that. If you are eligible for Medicaid, please, please, please check the federal poverty level chart. And you do have some time. In certain states, you have about 10 days to make adjustments to your application if you feel like your income is off. But that's just something good to know as well. For those that qualified for Medicaid and actually didn't want Medicaid and wanted to stay on their plan that they were on that was subsidized, then you would have to involuntarily get disenrolled from Medicaid, meaning you have to show proof, aka your income tax statements, your pay stubs, anything that has anything with your income on it. You do have to prove to Medicaid that you're not deserving of it. Now, I did make a video a couple months back about people on Medicaid that didn't want to be on Medicaid and were forced to be on Medicaid that wanted to be on a subsidized policy. I made a video about, hey, I never wanted Medicaid. I want to get back on my subsidized policy. If you sort of look through my channel there, you'll see that video. But in a nutshell, what you're going to have to do is involuntarily disenroll and not cancel. If you straight up cancel your policy through Medicaid, then what they're going to do is say, okay, you canceled it and you're not going to get any subsidies. You actually have to get kicked off of Medicaid in order for you to get subsidies again. All right, tip number 5. Again, I'm like a broken record. Please get professional help. I mean, this is really going to help you manage everything, right? Your time, your efforts, right? If you're on the application, it's taking you 3 hours where it takes us 3 minutes. You know, if it's free, it's sort of a no-brainer at that point. So please reach out to a professional. I mean, we're here to help, and we've been specializing in the Affordable Care Act plan since its inception more than 10 years ago. So we know a thing about a thing or two. So let us go over your needs, right? We're going to do a needs analysis, right? We're going to go over your medications, your doctors, your specialists, the medical groups that you want to stay in, and anything else in between, dental, x-rays, whatever the case is, whatever you need customized and whatever you need more strength on your policy, we're going to provide, or we're going to find that kind of plan and see if they're going to be in network with all your doctors. And if it is, great, we have a policy and we're ready to go. On that topic, please make sure that all your doctors are in network. Again, doctors can move medical groups. Doctors can not be associated with a certain carrier anymore that you might still have. It's up to the doctor's discretion to do so. So if your doctor has switched medical groups and you're not aware of it, most doctors won't, just tell all their patients that they've switched all of these carriers and whatnot. If that's the case, that's our job to look that up and then call the doctor's office to see if they actually still do take the plan. And if they don't, then we're going to have to get you a different plan. So that's sort of the service that we also provide as well too. Tip number 7, make sure you know what policies are going to be available for you at $0 in terms of premiums and deductibles. So there are going to be $0 premiums available for certain income brackets. So again, it does not hurt to check if you do qualify. There's also, starting in 2024, $0 deductible plans for people who do not qualify for $0 deductible plans before, right? This is huge. This is a big development. This is one of my favorite developments, is that people that had a $5,400 deductible last year can qualify for a $0 deductible. Also, dental is not going to be offered starting in 2024 on the exchange unless you're under 19. It's going to be embedded in the policy. If you're over 19, then you might want to look into some ancillary policies. I mean, there might be even better ones than what was offered on the marketplace or on your state-based exchanges. So if you need assistance with shopping dental policies or any ancillaries, of course, reach out to us as well too. And lastly, if you are happy with your policy, your doctors are all network, your specialists are all network, your formulary is all great with your medication, everything is copacetic, and you love your plan, this will automatically re-enroll for next year. So if your income hasn't changed, your address hasn't changed, your household size hasn't changed, your income hasn't changed, then you can just leave it be. Have it roll over next year. If you do need to do a quick needs analysis, happy to do so. But if it's still all the right information, you feel like you don't have to do it, then it'll just roll over. So hopefully this video did help. I can get into another video going more specifically into other details about ACA open enrollment. But guys, please like and subscribe this channel. I definitely want to get this message out to other people that are definitely in need of this information. So until the next time, guys, I wish you the best of luck during the open enrollment, and give us a call at 323-844-8471 or email us at info@healthmutualnetwork.com, and we'd be more than happy to help. Thanks, guys, and I'll see you at the next one.